Hello guys, for the women watching this video who are pregnant, I say again congratulations to you, and you are waiting for the newborn or for the visitor to come. So today we are going to get in touch with the Mother and Child Health Handbook, a very important book but very funny. Many women don't know what the book entails. A woman can present in the clinic, or maybe the woman is coming for the antenatal, but he has no clue of the book he has having. Maybe it is now he is coming for the fourth clinic, but he has no clue on anything about this book. Maybe it's for postnatal, maybe it's bringing the child for immunization, but the woman or the mother doesn't have any information or any clue on how to use the Mother and Child Health Handbook. Now guys, today I'm going to take you through the Mother and Child Health Handbook. As you can see, a very beautiful book with a beautiful logo there, design of family. Now, you know very well, a family is a very important and crucial thing. So basically, on top of the book, we are having the name of the mother, name of the child, and contact number. So basically, the name of the child will be filled when the child is born. But when you start the clinic now, you're going to have the name of you as the mother and the contact phone number of you as the mother or the expected mother. So basically here we have a message for you. Dear father, dear mother, make it very important to read with your wife, to read with your husband this book. It's not for women only. Husbands in the room, make sure you help. You sit close by your expecting beautiful wife to read the important information or the message that we have for you on this handbook. So guys, again, we have the table of contents basically. So guys, on the table of contents, basically has outlisted each and every content may be found as each and every book. So we have the table of contents outlisting each and every important maybe information that you're going to expect to find in the Mothers and Child Health Handbook. We have the abbreviation maybe. The abbreviation basically maybe is very important for us, the health workers, for us, the students, the clinician, the medicals, officers, the nurses, the community health extension workers, anybody involved in the journey process of pregnancy. So we come here, we find information for father support for mother and child health. So basically, you as a father, you know what you need to do to your wife during pregnancy, during childbirth, after childbirth. What are your duties? What are your responsibilities? We get to find that in the Mothers and Child Health Handbook. Basically, you come again, you find here some illustration up to family planning. Now you know very well you need to consider family planning because nowadays the economy is very crucial. So guys, now in your health handbook or your Mother and Child Health Handbook, basically we have your information. So this information, basically if you open its maternal profile. So maternal profile is basically the information. That is your information as a pregnant woman. We have the medical and surgical history. That is a very crucial in assessing any risk that could arise during the course of your pregnancy period. So we need to take your history. There we have even you come and get here the previous pregnancy. Was the pregnancy successful? Was there any miscarriage? Was there any history maybe of bad obstetric history? We got to indicate it here on previous pregnancy history. Now, on the physical examination now, on your first clinic, where we say go and start your first antenatal clinic. So when you start your first antenatal clinic, we expect to do a physical examination of you as a woman, as an expecting woman, as a student, as a nurse. You are expected to carry out a physical examination of the pregnant woman. Here is the guide. Now you'll be guided on how the general examination, the blood pressure. Basically, you're going to carry out the needed vital examination of the pregnant woman. Now, woman expecting, you need to carry some cash because you are going to carry out some investigation on you. You are going to carry the HB. The HB is the hemoglobin level to ascertain the level of your blood, because during pregnancy now a lot of blood is needed because of increased demand to supply you and the fetus. We are going to carry out your blood group to avoid cases whereby you get the rhesus D isoimmunization. Then you go to the urinalysis to find any kind of sexually transmitted diseases maybe. So it's treated so that we cannot have cases whereby we're having a child infected by syphilis or gonorrhea. Then we check your random blood sugars, maybe to elicit, is there any risk of becoming maybe a diabetic mother during the pregnancy session? We are going to screen. We are going to screen you for TB. We are going to send you for an ultrasound. Basically, if it's 18 to 20 weeks gestation of your pregnancy, we are going to do an HIV test for you. We are going to do a syphilis test. We are going to do an hepatitis test. And guys, we are going even to carry out a HIV test for your partner to ascertain now your partner is negative, you are negative, you are good to go. Your partner is positive, you are negative, we are good to go. Now, guys, we come now on your now after moving there, you come to the very, very important and very crucial page. The page filled by the midwife or the nurse assessing you. So the nurse get to, after visiting or during your visits, your antenatal clinic visits, so the nurse is going to fill information on this page. Basically, it contains the lie, the presentation. Basically, it just assesses how the features or how the pregnancy is ongoing. So to elicit any maybe abnormalities, any dangers arising by, so we get to find it through the investigation. So we are going to list here each and every visit that you come, each and every antenatal visit, we are going to assess, is there increase in the fundal height? Now, indicating positive pregnancy growth. Is there heart rate coming? Is there positive fetal movement indicating positive pregnancy, guys? You're going to chart even your weight there. We are going to give you some clinical notes, some takeaway home for you guys. So here we come, the preventive services. So if you're starting your clinic, on the second child or the second baby maybe you're having, on the third baby you're having, guys, you're expected to get your preventive measures, which includes what? The tetanus injection, which is usually administered on the deltoid, on the upper arm, on the deltoid muscle, the left upper arm, so on the left aspect of the upper arm. So you are administered during your first visit. Maybe you'll get your first shot of the tetanus injection, going again 4 weeks, then 6 months, then continuing that with subsequent pregnancies. Then we have the malaria prophylaxis for those people living in malaria-prone areas, basically maybe in the coastal region of our countries where we get a lot of malaria cases. So you get the prophylaxis, the IPTs. Then you get the iron and folic supplements. Now, many women avoid taking the iron and folic supplements. Why? They say it causes, maybe they feel they are nauseated, they feel maybe they constipate, but it's very, very important as it gives you energy as the pregnant woman, and it also has that newborn that is being formed in your stomach to come out as to come out without complication, to come out normally, not abnormally. Because if you avoid to take those supplements, the folic supplements, you can come and get in a condition where you're born a child, the back is out. So we call it spina bifida, an open back. And you don't want that for your child because it's going to be a lot and a lot of expenses. It's going to be a trauma for you. So it's very best and very, very important for you to always make sure you are taking the folic supplements. Now, guys, the book continues. Now, I'm going to take you through even the danger signs during your pregnancy. Danger signs during your pregnancy. What do we expect maybe during your what do we expect and what do we expect during your pregnancy? What indication or what when we see during your pregnancy, we can say this is the danger sign. Maybe we see your body becoming pale. Maybe we see you're having severe headache, vaginal bleeding, fevers, you're having swelling of the face, breaking of the water, convulsion and fits. Now, guys, those are very, very dangerous signs, very, very crucial and alarming signs for you as a pregnant woman, and it warrants for you to run to the nearby facility, to the nearby dispensary to get help. Now, guys, in the next episode, we are going to dive further in the mother and child health, in the mother and child health handbook. Afya ya mama na mtoto. So, guys, you are going to take you through this guideline with you. Maybe if you are lazy to read by yourself, now today I'm going to take you through Sit back, relax, and enjoy each and every episode of this Mother and Child Health Handbook. Sit by with your families. You can sit by with your husband to enjoy the session, guys. Now, in order to be updated, in order to be notified, in case I post or another episode drops of the Mother and Child Health Handbook guideline on how to use it, basically for you as the medical practitioner, for you as the health worker, or for you as the expecting mother, or for you as the expecting dad. That to be. So you need to subscribe on this channel to be informed, to be notified when I drop any new content, basically on the Mother and Child Health Handbook. Now, guys, antenatal clinic just made easier. Antenatal health, antenatal information or antenatal lessons made easier for you guys, especially for the lazy mothers. I'm not saying you are lazy, but there are lazy mothers who even skip the antenatal. They just present when they are already in labor. And that is very, very bad. Okay, guys, till the next episode. Bye.